Loose bodies. Loose bodies are actually one of the very important differentials of synovial chondromatosis, and at times it becomes really difficult to actually understand whether it's synovial chondromatosis or it's loose bodies, because what we see it on x-ray, we cannot see the soft tissue on x-ray, we cannot see the synovium, we cannot see the other causes of the synovial chondromatosis. So when you get an x-ray, this is an AP view of a knee joint. If you see this sort of loose bodies which is lying intra-articularly into the intracondylar notch, then probably this could be a loose body. But if it's isolated, single, large, this could be a single chunk of a cartilage which is actually the part of synovial chondromatosis has gone out, because you cannot appreciate exactly whether the synovium is hypertrophied on x-ray or not. Therefore, x-ray at times is not exactly a good tool to differentiate loose bodies from the synovial chondromatosis. These are the fragments of cartilage, or sometimes it can be bone as well, but mostly these are actually the cartilaginous fragments which have actually, due to a certain traumatic event or due to initiating event which has resulted in the trauma to the cartilage, this causes shedding of the cartilage into the joint, leading to a loose body formation, a cartilaginous loose body formation. But if you see a lot of arthritis in the knee joint and osteophyte formation, there's every possibility that one of the osteophytes may have shed off and gone into the joint, leading to formation of a bony loose bodies. Therefore, even sometimes on x-ray, it's very difficult to differentiate whether this is purely a cartilaginous or is it bony, or it could be a mixed picture as well. These are usually freely floating inside the joint space, and as they're not attached and freely floating, therefore the first and foremost is almost come up with the mechanical symptom, that is the locking, catching, giving way. These kind of symptoms are actually more common as compared to the other symptoms of pain, swelling, effusion, and rather than mechanical symptoms, the mechanical blockade to the motion is more common in this loose bodies. Now coming to the etiology. Etiology could be multiple. One of the causes could be associated with injury or trauma. The trauma happened at times. This resulted in a damage to the cartilage, which eventually, once the soft tissues have healed, this cartilage got necrotic and actually dissociated from the other underlying cartilage and eventually gone into the joint. Then it could be due to osteochondrous dissecans. As we know that we have 4 types of osteochondrous dissecans. There's a Clanton classification in grade 3 or 4. The osteochondral part actually dissociates from the subchondral bone. It may stay there, or it may get dislodged into the joint as well. Therefore, this loose body which we see may be actually a part of osteochondrous dissecans disease, and eventually have progressed to a formation of a large cartilaginous body is going into the joint. Or it could be associated with osteoarthritis. Osteoarthritis, why? Because once osteophytes formed, there is every possibility that large osteophyte may actually break up, or this eventually shed off some part of their osteophytes and eventually goes in as a freely floating loose body into the joint. Then neuropathic or Charcot's disease. Why this sort of a problem is more common in diabetics is because of abnormal mechanical stresses on the joint. And if we are standing on a certain angle, and our body is very well aware of it, because of neuropathy, they're not aware of the actually the stresses occurring on the joint. If at any point of time there's a lot of stress in any one place, there's every chance that cartilage and subchondral bone may get damaged over there, leading to eventually formation of arthritis later on, which may eventually mimic this osteochondral lesion may shed off and eventually mimic loose bodies. Therefore, then synovial chondromatosis, it could not be loose bodies, but it could be synovial chondromatosis. Therefore, we all have to keep it in mind that actually there was synovial hyperplasia. There was associated with increased synovial fluid production, and eventually the metaplasia of the cartilage leading to a cartilaginous body formation, which may have been shed off as a loose body, but underlying problem could have been the synovial chondromatosis. Therefore, clinical features mainly mimic of the loose bodies mainly mimic or revolve around the mechanical symptoms mainly. The most commonly, usually it may be symptomless. There may be incidental finding, because if it's isolated and small loose bodies which is not actually causing any mechanical symptoms, usually would be painless and would be symptomless. Then it's the joint locking, that is locking and catching are sometimes the most important symptoms, and these are symptoms which appear quite early on, because these cartilaginous or osteochondral loose bodies are actually freely floating. During the movement of the knee joint, they may get trapped in between the tibia and the femur on the medial and the lateral side, and as a result cause further damage to the underlying structures, as well as actually a mechanical block to the motion. If that happens, this further produces synovitis, and once synovitis is produced, this would lead to synovial hypertrophy and cartilaginous metaplasia, and eventually leading to synovial chondromatosis. So if you understand, synovial chondromatosis may produce loose bodies, and loose bodies may eventually lead to further synovial chondromatosis. So this is kind of a cycle which can repeat itself, and sometimes it's very difficult, despite all the detailed history, to actually differentiate whether this loose bodies is due to synovial chondromatosis or there's some other cause which is actually causing the formation of this loose bodies. And then it's popping of the joint, which is especially because once they get stuck in, there is always associated with the suddenly the knee gets locked, and when there are trick movements being applied by the patient, this results in the popping of the joint or the popping sound which can be heard, especially when the knee comes out of the lock. And then classically they say that something is actually going in the joint, something is moving in the joint. Usually, as sometimes the patient does not really use medical terminology, but they come up with it as if there's a mouse which is running inside my knee. This is common because at times this loose body would be somewhere in the postsuperior lateral aspect, sometimes it would be in the posterior medial aspect, sometimes it would be in the anterior, sometimes in the posterior region. So there's no actually exact place where it could be. Therefore, depending upon where it causes the symptoms, usually patient complains that it is as if there is a mouse which is running in my knee, but actually there is a large cartilaginous body which is being freely floating in the knee joint and actually causing different symptoms at different places.